My name is Margot Kushel, and I'm a professor of medicine at UCSF, where I'm a practicing general internist, and I direct the UCSF Benioff Homelessness and Housing Initiative. We think of the relationship between health problems and homelessness as what we say is bidirectional, meaning it goes both ways. Poor health itself is a risk factor for homelessness. So let's think about some of those older adults who first become homeless late in life. Time and time again, we hear that the thing that finally pushed them into homelessness was a health problem. So these are people working, let's say, physically demanding jobs, few protections. Let's say they're working in a warehouse. They haven't had good access to healthcare their whole life. They haven't had good access to healthy diets. They haven't had access to a healthy environment. They are confronted with anti-Black racism or anti-Indigenous racism their whole life. These are weathering problems. These are things that sort of cause people to age prematurely. And then they're 52 and they have a stroke, and their stroke leads them to lose their job. And then they become homeless. And so not surprising that they're homeless and they have these health problems. But we say it's bidirectional because homelessness itself is one of the most important social determinants of health. Housing is one of the most important things to health. And when you don't have that housing, you don't have that. And so we see health problems accelerating. So first of all, we see people's, diet and exposures to violence and, wildfire smoke and other bad environmental pollutants, to motor vehicle accidents. All of those get much worse. We see people really lose access to healthcare, so that it's very hard, let's say, to get treatment for diabetes or high blood pressure. When you're experiencing homelessness, it's hard to go through all those steps of making it to the doctor, of getting a prescription filled, of taking that medicine every day. We see it very hard to get into healthcare when something goes wrong. So small problems become big problems. A cut on your leg progresses to a big infection, progresses you to needing your leg amputated. And so we see this bi-directional relationship. The sicker you are, the more likely it is that you become homeless, and becoming homeless makes you more likely to be sick. And so all of these together leave us with a population who, although the public thinks of them as middle-aged adults, 50s, early 60s, by all intents and purposes, they're living the life health-wise of a much older adult, but without any of the protections that society puts in place for older adults. And so this really causes harm. And I think one of the many, many tragedies of this situation is that once older adults are homeless, their chance of dying goes way up, and they die early. And so many folks who've, let's say, worked their whole life and paid into Social Security and are waiting for Medicare and Social Security, frankly, don't live long enough to receive those, and they've paid into the system their whole life, but never get the benefits of that.